Assalamu alaikum. My name is Dr. Abdul Wahab, Associate Professor, Department of Pharmacy, University of Science and Technology. Our today's topic is pharmacoeconomics. So, before going to discuss in detail, here are some outlines like introduction of economics, pharmacoeconomics, history of pharmacoeconomics, cost, and consequences. So these are the different topics about which today we would like to discuss in detail. So first of all, economics. Before going to discuss the term pharmacoeconomics, so we would like to discuss about the economics. So economic is derived from the Greek word oikonomia. Its meaning is household management. Oikos means household and nomos means management. So we can say that economics is the combination of two Greek words, oikos and nomos. Economic is the social science that studies the production, distribution, and consumption of goods and services. It is the basic definition of economics. So, we can also define the economics. It is the study of how we satisfy our wants and needs with the limited resources we have. If we are having a limited resources, and at the same time if we are having needs or wants, so for the satisfactions of the wants and needs, uh, we should study the different materials related to economics. So, scarcity, all resources are limited and therefore are scarce. Everyone can't have everything they want. There is not enough stuff to go around. Micro and macroeconomics. These are the two general types of economics. So, microeconomics, as you can see over here, it is the study of economic behavior among individual consumers, families, and business, whose collective behavior in marketplace determines the quantity of goods and services demanded and supplied at different prices. So similarly, macroeconomic issues for the entire economy is the study of the broader economic picture and how an economic system maintains and allocates its resources. It focuses on how a government monetary and fiscal policies affect the overall operation of an economic system and the standard of living of its citizens. So we can say that in microeconomics, the microeconomic term is used for the small scale and macroeconomic is used for the large scale. Pharmacoeconomics, it is our basic topic about which we are going to discuss in detail. So, pharmacoeconomics, the word pharmacoeconomics is the combination of two words, pharmaco and economics. It is the combination of two words. As we discussed that economics is derived from Greek word oikonomia. Similarly, pharmaco is also derived from Greek word pharmakon. Which word? Pharmakon. So pharmakon means drug. So in pharmacoeconomics, we study about management of the cost of the drug therapy and pharmaceutical services. And pharmacoeconomics can also be defined like the description and analysis of the cost of drug therapy to healthcare system and society. It is the definition of pharmacoeconomics. And we can also define the pharmacoeconomics research. Pharmacoeconomics research identifies, measures, and compares the cost resources consumed, for example, resources consumed, and consequences. Which type of consequences? Clinical consequences, economic consequences, humanistic consequences of pharmaceutical products and services. We can say that pharmacoeconomic research identifies, measures, and compares the cost and consequences of pharmaceutical product and services. Pharmacoeconomics analysis: efficient allocation of limited resources among competing alternative medications and services, biggest bang for your buck using a quantitative measures to make the best use of limited resources. Pharmacoeconomics. The term pharmacoeconomic was coined by Ray Townsend in 1986. It is a branch of health economics. The term, this term, pharmacoeconomics, was for the first time introduced by Ray Townsend when in 1986. So it is pharmacoeconomics is the branch of health economics. Making choices between options when there is scarcity of resources and fundamentally comparative weighing the cost and benefits of two options. Goal of pharmacoeconomics, objective of pharmacoeconomics, and composition. What is the goal of pharmacoeconomics and what are the objectives, or we can say what is the objective of pharmacoeconomics and what is the composition of pharmacoeconomics? So the goal is to identify, measure, and compare what costs and consequences, outcomes of pharmaceutical interventions or pharmaceutical products. We can say the different drugs or pharmaceutical processes. It is the goal of pharmacoeconomics. What is the goal of pharmacoeconomics? To identify, measure, and compare costs and consequences of pharmaceutical interventions. And the objective of pharmacoeconomics is to allocate healthcare resources, ensuring that each patient receives the most suitable treatment. It is the objective of pharmacoeconomics. Composition. It includes ideas and methods from a variety of domains, including statistics, clinical epidemiology, decision analysis, and psychometric. It is a multidisciplinary field. Similarly, as you can see over here in this picture, it is cost, it is the drug, it is represented by this symbol, and it is these are the outcomes. You can, as you can see over here, it is input and it is output. Output means outcomes and input means costs of what? drug, pharmaceutical product or services. So, if we are going to study this part of this reaction, so it means a partial economic pharmacoeconomic study. So we can say that it is only economic study. But if we are going to study this part of any drug in outcome, so we can say and we can use the term for such type of study clinical or outcome study, not an economic study. But if we are going to study the cost of drug or pharmaceutical product or services and outcomes, then we can use a broad term that is pharmacoeconomics. So in pharmacoeconomics, we analyze the cost and clinical outcomes. Pharmacoeconomics is a set of methods to evaluate the economic, clinical, and humanistic outcomes of pharmaceutical product and services. Economic cost efficient, clinical effectiveness, humanistic impact on healthcare system, individuals, and the society. This is a diagrammatic presentation of the previous discussion. History of pharmacoeconomics. In the early 1960s, pharmacy as a clinical discipline gained the recognition within the healthcare system because without the pharmacist or without the pharmacy discipline, healthcare system is incomplete. At this point, some subjects became part of pharmacy education, such as clinical pharmacy, drug information, and pharmacokinetics. And pharmacoeconomics rooted in 1970s. The first book on health economics published in 1973 and 1978 in the University of Minnesota. The concept of cost benefit and cost effective analysis introduced through the work of McGon, Rowland, and Botman. These are the three men who, for the first time, uh, give the concept of cost benefit and cost effective analysis. Make use of the complicated pharmacokinetic procedures. Botman published an early pharmacy research editorial in 1979 displaying cost benefit analysis and of glucoside dosages. In 1983, the University of Ohio College of Pharmacy initiated a particular pharmacy education curriculum. The intent of the university was to provide the idea of the utilizations of cost effective and cost benefit analysis in the healthcare system, with emphasis on their application to the delivery of pharmaceutical care. So, as we have already discussed that this term was the term pharmacoeconomics was used for the first time by Ray Townsend from the Objohn Company in a public forum at a meeting of the pharmacists in Toronto, Canada in 1986. Currently, pharmacoeconomics research is a prosperous industry with numerous practitioners, an outside study, and an application program. Additionally, There are a number of journals and successful professional societies, including the International Society for Pharmacoeconomics and Outcomes Research. Perspectives of pharmacoeconomics: assessing costs and consequences. The value of pharmaceutical product or service depends heavily on the perspective of the evaluation. Common perspectives include those of the patient, provider, payer, and society. So these are the different element. So we can say that the patient perspective, provider perspective, payer perspective, and society perspective. A pharmacoeconomic evaluation can assess the value of a product or service from single or multiple perspectives. Once the perspective is clear, a full evaluation of the relevant costs and consequences can begin. So, as you can see over here, the different perspectives like patient perspective, provider perspective, and payer perspective, societal perspective. After selection of perspective, next step cost related measurement. Next step is cost related measurement. So the first one, patient perspective. Patient perspective is a paramount because patients are the ultimate consumers of healthcare services. Costs from the perspective of patients are essentially what patients pay for a product or service that is the portions not covered by insurance. Consequences from a patient perspective are the clinical effects, both positive and negative, of a program or treatment alternative. Patient perspective: all the relevant costs and consequences experienced by the patient, included cost, direct cost, indirect cost, and intangible cost. Provider perspective: costs from the provider's perspective are the actual expense of providing a product or service, regardless of what the provider charges. Providers can be hospitals, managed care organizations, or private practice physicians. These are the providers. So, concerned with the expenses of providing products or services, from this perspective, direct costs such as drugs, hospitalization, laboratory tests, supplies, and salaries of healthcare professionals can be identified, measured, and compared. Payer perspective: social security, government, third party payers, for example, private insurance companies and employers, included cost, direct cost, indirect cost. So, indirect costs relevant to employers, lost work days, or lost productivity at work. Societal perspective: the broadest of all perspectives that comprehensively evaluates all costs and consequences. Consider the benefit to society as a whole, included cost, direct or all cost of providing care, and indirect loss of productivity. So, cost, as we were discussing about the direct and indirect cost. So, cost involves all the resources that are used to produce and deliver a particular drug therapy. So, types of cost: direct cost, medical versus non medical, and indirect costs, intangible cost, and opportunity costs. So, these are the different costs. So, direct costs, for example, medication, supplies, laboratory tests, healthcare professional time, hospitalization. These are the direct cost. Direct non-medical cost. So these are direct medical costs. These are direct non-medical costs: transportation, food and family care, home aids. Indirect cost: lost wages, morbidity, income foregone because of premature death, mortality. Intangible cost: pain and suffering, inconvenience, grief. These are the intangible cost. Opportunity cost: lost opportunity, revenue foregone. Direct cost. So direct medical costs are the costs incurred for medical products and services used to prevent, detect, or treat a disease. This includes fixed costs and variable costs. So are costs they don't vary immediately with the number of patients treated. For example, capital cost of hospital building or equipment, etc. Variable costs are costs that vary immediately with number of patients treated. For example, cost of drugs, syringes, needles, etc. Direct non-medical cost incurred by the patient in receiving medical care, for example, transportation to and from hospital. Indirect non-medical costs. Indirect non-medical costs are the costs of reduced productivity, morbidity, and mortality. Indirect costs are costs that result from morbidity and mortality and are an important source of resource consumption, especially from the perspective of the patient. Morbidity costs are costs incurred from missing work. For example, lost productivity, whereas mortality costs represent the years lost as a result of premature death. Intangible cost. Intangible costs are those of other non-financial outcomes of disease and medical care. For example, cost of pain, worry, and other suffering which a patient or his family might suffer. Opportunity cost. Opportunity cost represents the economic benefit foregone when using one therapy instead of the next best alternative therapy. The amount lost by not using economic resources in its best alternative use: labor, capital, building, management, etc. Resources invested in one area will be at expense of loss of another opportunity. Consequences or outcomes. Similar to cost, the outcomes or consequences of a disease and its treatment are an equally important component of pharmacoeconomic analysis. The manner in which consequences are quantified is a key distinction among pharmacoeconomic methods because the assessment of cost is relatively standard. Like costs, the consequences or outcomes of the medical care also can be categorized. One approach is to separate outcomes into three categories: economic, clinical, and humanistic. Eco model: economic outcomes, clinical outcomes, and humanistic outcomes. Economic outcomes are the direct, indirect, and intangible cost compared with consequences of medical treatment alternatives. Direct, indirect, and intangible cost. Clinical outcomes are the medical events that occur as a result of disease or treatment. For example, safety and efficacy endpoints. As a result of disease or treatment, survival, mortality, and morbidity. Humanistic outcomes are the consequences of disease or treatment on patient functional status or quality of life along several dimensions: physical function, social function, general health and well being, and life satisfaction, patient preferences and utilities, quality of life. Assessing the economic, clinical, and humanistic outcomes associated with a treatment alternative provides a complete model for decision making. Positive versus negative consequences. An example of positive outcome is desired effect of a drug, efficacy or effectiveness measures, possibly manifested as a case cured, reduction in hemoglobin, life year gain, or improved health related quality of life, HRQOL. Because all drugs have adverse effects, negative consequences also can be occur with their use. A negative outcome is an undesired adverse or adverse effect of a drug, possibly manifested as a treatment failure, an adverse drug reaction, or drug toxicity, or even death. Intermediate and final consequences. Consequences also can be discussed in term and intermediate and final outcomes. Intermediate outcomes can serve as a proxy for more relevant final outcomes. For example, achieving a disease decrease in low density lipoprotein cholesterol levels with a lipid lowering agent in an intermediate consequences that can serve as a proxy for a more final outcome such as decrease in myocardial infarction rate. Application of pharmacoeconomics. Pharmacoeconomic study, or we can say the pharmacoeconomic assists in decision making and allocating scarce resources. First application, and second application, assessing the value of any agent. Then third application, formulary decision making. The fourth one, drug policy decision, treatment guidelines, and justification or justify the addition of new clinical service. Pricing in pharmaceutical industry, decision on reimbursement. A third party payers use such information to decide whether to pay for a particular treatment or to determine what price they are willing to pay. So these are the application of pharmacoeconomics. So drug therapy evaluation, it is also the application of pharmacoeconomics. Historically, pharmacoeconomic principles and methods have been applied commonly to assist clinicians and practitioners in making more informed and complete decisions regarding drug therapy. So, for the complete and informed decision, uh, mostly the clinician and practitioners take help of the pharmacoeconomic study. For example, pharmacoeconomics can provide critical cost effectiveness data to support the addition or deletion of a drug or to form a hospital or formulary with or without restrictions. In fact, the pharmacoeconomic assessment of formulary action is becoming a standardized part of many pharmacy and therapeutic committees. The application of pharmacoeconomic also can be useful for making a decision about an individual patient therapy. Individual patient therapy. Clinical pharmacy service evaluation. The most recent application of pharmacoeconomic principles and methods have been for justifying the value of various healthcare services, particularly pharmacy services. When a specific service is competing for hospital, Resources, pharmacoeconomics can provide the data necessary to show that the service maximizes the resources allocated by healthcare system administrator. Pharmacoeconomics can be useful in determining the value of an existing service, estimating the potential worth of implementing a new service, or capturing the value of a cognitive clinical intervention. Practitioners and administrators can then use these data to make more informed resource allocation decision. So for the more informed resource allocation decision, the practitioners and administrators use the pharmacoeconomic study or data, and is the conclusion of our today topic, pharmacoeconomics. Pharmacoeconomics identifies, measures, and compares the cost and consequences of drug therapy to healthcare systems and society. The perspective of pharmacoeconomic evaluation is paramount because the study results will be highly dependent on the perspective selected. Healthcare cost can be categorized as direct medical cost, direct non-medical cost, indirect non-medical cost, intangible and opportunity and incremental cost. Economic, humanistic, and clinical outcomes should be considered and valued using pharmacoeconomic methods to inform local decision making whenever possible. To compare various healthcare choices, economic valuation methods are used, including cost minimization, cost benefit, cost effectiveness, and cost utilities. These methods all provide the means to compare competing treatment options and are similar in the way they measure cost. So, in our next lecture, we will try to cover all these analysis and all these methods. So these methods all provide the means to compare competing treatment options and are similar in ways they measure cost. They differ, however, in their measurement of outcomes and expression of result. In today's healthcare setting, pharmacoeconomic methods can be applied for effective formulary management, individual patient treatment, medication policy determination, and resource allocation. When evaluating published pharmacoeconomic study, the following factors should be considered: study objective, study perspective, pharmacoeconomic method, study design, choice of intervention, cost and consequences, discounting, study results, sensitivity analysis, study conclusion, and sponsorship. Both the use of economic models and conducting pharmacoeconomic analysis on a local can be useful and relevant resources of pharmacoeconomic data when rigorous methods are employed. So these are the references for our today topic. Thank you so much. Stay blessed. Allah Hafiz.